Hi, this is Rachel Yucatel with Misunderstood Podcast. I am here at the Neinstein Plastic Surgery office. I'm going to talk to Dr. Neinstein about all things misunderstood about plastic surgery. Let's get to it. So I'm here with Dr. Ryan Neinstein. It is so good to be in your office. You have such a beautiful office. Thank you for having me.
Rachel, thank you so much for coming. This has been on the schedule for a while. I've been really looking forward to it.
Yes, well, thank you for making time because I know you have so many surgeries and you just came out of one. So the first thing I wanted to ask you is what made you decide to go into plastic surgery instead of, say, being a cardiologist?
I always loved the pursuit of medicine when I was young. And I was really into sports and really into science. Medicine seemed like a natural place to go, something I wanted to spend the rest of my life with. As a grandchild of Holocaust survivors, I was always taught to have a life of purpose. So I pursued medicine. Quickly in medicine, I realized that normal medical stuff just wasn't for me. I could not listen to a murmur if I tried. I never really understood giving someone a pill and then waiting to see what came up on a lab report. So surgery spoke to me immediately. I think I would have been really happy with any type of surgery. I'd love the process of operating and change. But plastic surgery specifically, it's the only operation where people come to you when nothing bad has happened to them and they want to do better. So people who are committed to self-improvement, committed to improving the quality of life, come to see plastic surgeons. Every other operation, something bad's happened, a disease, a trauma, an infection, a tumor, people are coming to us. So I just find it super moving that people are willing to do this to improve their life.
Right. Oh,
which ups the ante for me.
Absolutely. What a great answer. So you do not do anything on the face. You do from the neck and below, correct?
Correct.
Tell me what you specialize in.
So, I try to keep the main thing is the main thing. So if I was going to a surgeon for something, I want them doing whatever I want to be done every single day. I want them thinking about the procedure all day, every day. So that's how I've molded my career. So I stick to breast and body. They work in harmony. When you're doing breast surgery and body surgery, you want to be doing them, frequently doing them together at the same time because you're trying to balance the proportions. You're trying to optimize the body, optimize the torso, optimize the aesthetics. And then in simple terms, it's like the psychology, I think we were talking about it before, is a little simplified in the sense that flat tummy, perky boobs, everyone's happy. But it's really, when you're changing someone's face, no matter how great the operation is, there's a little bit of the unknown when it comes to the psychology of the change.
Right. So how often are people coming to you for first-time surgeries, and how often is it to redo something that was done wrong?
So it's 60-40 in my practice. 60% primary operations, meaning they haven't had surgery before. What's interesting is that many of my patients have never had plastic surgery, which for some reason people think, which is odd. But a lot of my patients are moms. They've had a few children, and they take excellent care of themselves. They eat well, they exercise. They've never thought about having surgery for vanity. But after a few years, after the kids, they're staring at themselves in the mirror, and they're like, 10 years ago I was wearing a bikini, and now I look like this is ridiculous, and I can't change it with diet or exercise. I got to do something.
Right.
And that's, kind of the sweet spot for us. The Mommy Makeover is kind of my go-to operation, which to me just delivers the most quality of life change for anyone. So, but the revision, sorry to interrupt you,
go
but
ahead.
The revision's about 40%. It's challenging. Like my favorite President Kennedy says, we do the hard things because they are hard, and that's how you get great. But that is, a challenging operation because you're taking someone who's, damaged or some version of damage, and you're trying to not just make them whole, but make them better.
So I know we're talking about how you specialize in the neck down, but just talk to me for 1 second about aging. What is it when people look at themselves or other people that is so obvious about the aging process? Is it the tone of the skin? Is it the sagginess in the skin? What is it that we all see that looks unattractive to ourselves?
Well, it's interesting because I hear the same thing all the time from patients, and they say it's more of a feeling than a look. And I can talk about exactly what they're looking at, but I hear this from my patients. I feel too good to look this old, or I feel too good to look this bad in their terms.
Right.
So I have two peaks of ages of patients who come to see me. The kind of mid-30s, early 40s, these are people who just had their children, and they're like, I'm not living like this. Period, full stop. Like, fix my tummy, fix my breasts, like, let's go. And then there's the second peak, which a lot of people are surprised when half of my patients are 50 plus. Basically, these are people who didn't have surgery after their kids, and they're around menopause, and menopause just exasperated or elevated exponentially what was happening before. And they've just been, and they're like, they still feel amazing. You know, they're 55, they're 60, they're 65. They travel, they feel, you know, they're going to the theater, they're going out, they have an active lifestyle, but things have just become, you know, beyond what what's acceptable to them for their lifestyle.
Right.
Most commonly, it's stretched, loose skin. We see a lot of thin, fit women in their mid-30s and in their mid-50s. The thinner you are, the fitter you are. Pregnancy and age are going to stretch the skin. People don't like having the frame of a twin bed and the bedding of a king. They want it matched, okay?
Because otherwise, a really good way to look at it.
Because otherwise, it just doesn't look right. It doesn't feel right, especially if you put so much time and energy into taking care of yourself.
Right, right. So do you think people have gotten over the taboo a little bit of saying they got plastic surgery? Because I know a lot of people don't like to admit it, or, you know, they deny having it when it's clear that they have had it.
Yeah, I don't see that at all. It's just part of people's lives now. I think sophisticated people recognize that plastic surgery solves this very specific problem for them. And that's a sophisticated patient, and that's the kind of person we want in my practice. These are people that, hey, I eat well, I exercise. Like these women exercise a lot. These are not like walk on the treadmill once a week. These are, you know, hardcore Pilates, weightlifting every day.
Right.
And they want to make a sophisticated move. Okay, I have twice the amount of skin on my stomach as I need. I'm going to go to someone to solve this problem.
Right.
There's no taboo about that. They're using plastic surgery as a tool as they would anything else in their toolbox in life. Right. Whether that's their hair person, a lawyer, an accountant, like anyone I'm solving a problem. Literally, you know, there's a journey that everyone goes on. They have a frustration in their body. They try every other possible means, because why wouldn't you? Then they come see me. I give them a solution to their frustration. We do the operation, and then they get the psychological benefit of having their problem solved.
Right, right. So there's only so much that like a spray tan, eyelashes, hair extensions, all that good clothes, good makeup can kind of cover.
Well,
and
I do like the term or the phrase, if you can't tone it, tan it.
Yes, well, that's true. I love a good spray tan. Who doesn't?
Me too.
But you in your office, you do Botox, you do filler, all that kind of stuff. What is the difference about people coming and getting that filler before they do plastic surgery? Because I know a lot of plastic surgeons or dermatologists now use filler to change people's noses, to change the jawline, to even sculpt the butts. So what's the difference?
So while we're pretty aggressive in our office in the operating room, our injectable is almost like a maintenance package. A lot of our patients are very sophisticated consumers. They know what they want. They want what they know. A lot of them are looking for maintenance Botox, maintenance fillers. They love our office. They love our staff because they had surgery here. So we offer that service with a loyalty program, and they keep coming back. But we do not see altered appearances. We do not do that. It's very light dosing of the toxin for a natural look. Some people like to be frozen. I personally like to be frozen. I mean, I just like the feeling of it.
Right.
But in terms of the fillers, we are very conservative here. And I think that taste has some regional differences. New York, people are, you know, they're built for speed here. There's not a lot of room on the street. They're, you know, it's smaller and it's tighter. You know, we don't see the big lips, the big cheeks demands in our office.
Right.
We see more subtle. But, you know, I was just in Miami on the weekend. Nothing subtle about those looks.
Right. There's nothing subtle about Vegas, LA.
But there's nothing wrong with that. It's just you have to know your audience, know your role. Just like the restaurants and the clothing are different in New York as they are in Miami and Vegas, and like it's all good as long as you want to make sure when you're going to a plastic surgeon that your aesthetic interests match their aesthetic tendencies. Because every surgeon's gonna, no matter what they tell you, like their brain is wired in a certain way. And when you're in the operating room, people fall back on their experience. They don't rise to the occasion. So like whatever they're used to doing is what you're gonna get.
Right. So I have a question about, you know, beauty and wellness magazines, stores, influencers talk about products and how well products work. Is there an actual product that you think does work, or do you think that people need actual help with surgery and Botox?
I know one thing in this life. Surgery works every time. Okay?
Right.
If you have extra
And
skin,
immediately.
if you have extra skin and you cut it out, it's no longer there.
Right.
Okay? If you have stubborn fat and we suck it out, it's no longer there.
Mm-hmm.
Everything else is a delay or a toy or may work. And I'm not saying there's anything bad with doing the non-surgical.
Mm-hmm.
My brain is wired to solve problems.
Right.
Yeah.
Right. So, but do you think that do you believe in things like creams that are going to tighten your skin?
No.
No. Okay. Well, that's
Yeah.
good to know. And what about
But
creams?
I believe in the tooth fairy, so
Right. Oh my gosh.
my son believes it's there.
Yeah. Do you believe that creams will help with making your skin look younger?
For sure. And, I'm not the person to ask for skincare because I'm the guy who just uses whatever my wife has on the counter and probably using the wrong thing in the wrong, sequence. But I have to believe that the science is there in skincare for the face.
Right.
But in my mind, I do like a deep laser once a year with my friend Paul Frank, who's a dermatologist, because I'd rather just do a deep laser once a year than do skincare every day.
Right.
So that's for me, because it's probably the same as if you have a really good skincare regimen versus just lasering your face once a year.
So what are the trends you're seeing right now in people coming into your office? Is it, you were telling me earlier, it's not so much big and bold, it's very subtle. Is that determined?
It's subtle, but it's complete. The Mommy Makeover procedure, which is the most common procedure I do, has never been more in demand nationwide. Women are not accepting the physical changes to their bodies from babies. It's period, full stop. They are not interested in living with deflated, droopy breasts, stretched, torn muscles, and skin, that's hanging off when they sit down.
Right.
If you are used to living this active lifestyle, traveling, enjoying your body, enjoying clothes, you're not going to want to do that when you're 32 years old for the next, however, many decades.
Right.
So people are doing bigger operations. It's conservative in the sense that they don't necessarily want big implants, but they want things fixed. They want things put back. If they remember, they always show me this. Look what I looked like in college. Look what I looked like before babies. And this is how I feel. Help me look like that again.
Right.
Because I can't do it with diet and exercise. So the combined liposuction, tummy tuck, muscle repair, breast surgery, that's the most common thing we do. And that's what we're known for. The number two thing we see is the explant. People want their big implants out.
Right. And is that driven by celebrities making more of a statement on their Instagram, social media that they're taking things out? And how, do you think that's affected the trend?
I think it's the previous generation of plastic surgeons. I think, most of the patients that come to see me or my breast specialist, Dr. Anna, who works with me, in the 90s, they saw a surgeon somewhere, and they got huge implants, and they had a great run with them. And now it's 30 years later, they're in their mid to late, 50s, early 60s, and their life is just different. They're I'm not the big boob girl anymore. I'm the grandmother.
Right.
And they're walking around with these, melons, and they're stretched, and it's a whole thing. And they're just let's downsize.
Yeah.
They don't typically want to totally get rid of them, but they want to downsize to something more appropriate for the clothing they like. They want to do a lift, try to rejuvenate with a little bit of fat. That's definitely the second most common trend. And 5 years ago, 7 years ago, never saw it. Wasn't a thing.
Right.
Now, get these implants out, doc. Let's go. Let's get me looking the way I feel.
Right.
And then the third is reversing BBLs.
Brazilian butt lifts.
Yeah.
Yes. Talk
Too
about
big,
that.
too big, too wide, too inappropriate.
Okay.
And again, there are people who like that look, and there's nothing wrong with that, obviously. But there are a lot of people who tried that look, and they have trouble walking down the street. They can't find clothing.
Right.
They got, tiny, narrow waist and a big, wide butt. I mean, it's looks. It's a different
look. By the way,
look.
but talk
so
to me about
reversing that.
Talk to me about how that is done. I mean, do they actually take your
taking the fat out?
But do they take ribs out or anything?
No.
How do you get someone's waist that small?
Well, it's a combination. The waist gets small and the butt gets big. So the differential gets pretty dramatic.
Right.
So these smaller people, they're having basically like all their fat taken out of their abdomen and their waist, and it's all being put in their butt. And it's a look. It's not for me. Mm-hmm. And there's a lot of people who tried it and didn't like it.
Right.
That's why I like timeless plastic surgery, because it's not like getting a haircut. It's not like trying new clothes. Like, if you don't like it, it's a big deal.
Yeah.
And especially the reverse BBLs, the skin has been stretched from all that fat. So, like, it's a real problem shrinking it down. It takes multiple sessions. They're always left with, like, you know, a cellulite cobblestone bum, which nobody wants.
Mm-hmm. So I've seen a lot of stuff on doctors' Instagrams where they're doing filler in the butt. Do you think that works just as well to kind of lift your butt?
A little. It's really, you know, the collagen stimulating, which we do a lot for the very thin patients, where there's literally no fat.
Right.
Fat's always king. That's the number one. But there's going to be patients who literally have no fat, and then we'll use that if they want a little boost.
And how would you do a butt surgery if they're not getting the injections? Per se, like, is there what's
so I
the
do
new
a lot
Brazilian
of what we call a
butt?
thin or a skinny BBL or baby BBL.
Got it.
A lot of the moms I'm doing mommy makeovers on want fat transferred to their butt, but they want like a perky athletic butt that looks good in, you know, leggings, not
right. That's
like,
what I want.
Yeah. I mean, who doesn't? Like,
yeah. So the procedure for that is their own fat.
We're using their own fat, and in terms of the volume, I'm using, you know, like a can of Coke worth of fat versus like 4 big gulps worth of fat.
Right.
And, you know, when you purify it and use it in a controlled, finesse way, you get a nice perky bum.
And does it last?
Yeah.
Wow.
Yeah. Once it, like 60-70% of what we inject stays, but like then that's your fat. Like, that's not going anywhere.
See, that to me is amazing.
And a lot of thin BBLs, athletic BBLs, we do a lot of people who exercise a lot, and they can get very thin, but they can't do anything to their bum. So we are really, you know, I always joke like I can get fat at anybody. So a lot of surgeons refer me like thinner, active women, and like, you know, I always find the fat.
Right. Nice. Okay. Well, that's what I want in my next life. We can work on it.
Yeah. I'll check my schedule next week.
Yeah, you can check out my butt. Tell me what I need. So what about people so a big thing right now is in social media, for example, all the filters and how it changes either their bodies, their face, whatever it is. Do people come into your office and say, I want to look like this?
Like people always come in with their inspiration pictures.
Yeah.
And everyone uses similar pictures, and it's always like some 19-year-old Brazilian model, and like, you know, I'm talking to like 57-year-old mom of 4 from New Jersey,
right.
And listen, I always say I agree. Like, I want to look like that too. Everyone wants to look like this. It lets me orient. I really don't think they have a distorted version of reality when they show me wish pics, because like it's a wish pic.
Yeah.
People are more realistic and sophisticated than I think maybe surgeons give them credit. They know they're not going to go and look like a 19-year-old, but they just want you to know what they want.
Right.
And then I say, I'm going to do the best I can with your body, and I'm going to take you as far as I can, and then we're going to get you on the workout program, and then you're going to take it to another level.
Right. So you help them with their realistic expectations of how that you can apply that picture to them to make them look the best that they can.
Yeah.
Have
exactly.
you ever said no to a patient about something?
Yeah, I say no all the time, and it's not a negative or derogatory thing. Typically, it's not the right time in someone's life. Like, a lot of people in the midst of a divorce turmoil, not a good time to have plastic surgery. Like, you don't want to have background, like, intense emotional stuff going on. You want to settle, because surgery, any form of surgery, can kind of unleash whatever is happening. So you don't need to, like, escalate that. So you want stability. And the other thing is, when someone wants an operation, and I understand this all the time, and this is something that we see all the time, people are like, I just want a little lipo, but their skin's hanging down to their knee, and they're like, you need a tummy tuck. And they're like, but I don't want a tummy tuck. I'm like, I understand you don't want it, but you need it.
Right.
So a lot of times we're saying no because the goals don't match the operation they're willing to have. And it's always better to not do an operation than do the wrong operation.
When people are looking for a plastic surgeon, what are the questions they should be asking, or what kind of doctor should they be looking for?
Well, I think this is a marriage. Like, we do big surgery. Like, we are with you for like basically life. Okay, there is a connection here. When you're meeting a surgeon, it's almost like you're marrying into their whole family as well. You need to get to know the staff. You need to get to know the facility. Like, you have to walk in and be like, this is a place where I want to be operated on. If it's in the basement somewhere, like, probably don't want to have surgery there. If they have a tiny little operating room, you probably don't want to have surgery there. If they don't have a big dedicated team that's like cohesive and everyone's smiling, like, within 30 seconds of walking into an office, I know whether or not I want to be there. It's got to be clean. It's got to smell good. They got to have the right music. The people at the front desk need to be smiling. Everyone's got to want to be there. That's number one. Number two, the surgeon's got to do what you want every day. Not once a week, not once a month, not, it's like, you want breast surgery? Go to someone who does breast surgery every single day. You want a tummy tuck? Go to someone who does a tummy tuck every day.
Right.
Because there is nothing that substitutes, purposeful passion towards a singular outcome.
Right.
Nothing. You cannot. It is impossible to do excellent surgery. And the ocean between good and great is vast. So if you want a 7 out of 10, you can go to someone who does it once in a while. But I play to win, and I'm going for the 10 out of 10 every time.
Right.
Okay? That's the way I'm wired. Like, why wouldn't you want to have the best outcome possible on the planet every single time?
Yeah, I think
and the personality's
really
got to match with the doctor.
Yeah, you have to have chemistry. But I think
you have to be into the same thing. Like, you're going to be talking to this person basically for years about your body. You're going to be with them naked a lot. Okay?
Right.
Like, you better be comfortable with this person. Like, you should have similar interests, morals, ethics, like, because you guys are in it forever.
I think that's really important what you said before, too, though, that you should go to a surgeon who specializes in the one thing that you want. Because, I've been to plastic surgeons plenty of times, and they mostly do general surgery. They do everything. They do face, they do nose, they do boobs, they do labia surgery, they do everything.
I chose, because I'm so committed to mastering something, I chose to live and work in a city that has high density that allows me to do that. If you live in Wichita, Kansas, as your plastic surgeon, you probably need to do it all. Because there's just not enough people.
Yeah.
But that surgeon chose that mentality, and that patient should match that. And they probably get a really good outcome.
Right.
But there's just a difference. Like I said, the difference between good and great might be small, but it's so meaningful, powerful, and significant.
Right. So when you're walking down the street or interacting with people, is it hard for you not to judge them as a doctor and
Never.
say, I could fix
Zero.
that? You don't do that?
It's just not a thing in my life.
Interesting.
No, when I'm talking to someone, I'm trying to absorb knowledge. Like, I always want to be the dumbest guy in the room. I always want to ask one more question than everyone else. Be a little more curious. That's why, I read 2 to 3 books a week. Anytime I'm around people, I'm trying to get information, like, learn what are these guys? What secret do you know about life that I don't know?
Right. That's interesting.
I'm not going the other way.
Yeah.
Yeah. God gave me, 2 ears, 1 mouth. So should listen twice as much as I speak.
So, but how often are people coming up to you and saying, what do you think of my butt? What do you think of my boobs? What
Not
could I
as
fix?
much as people think. And I, like, if you're at a restaurant, like, and someone, it's awkward. So, and it's inappropriate. I'll say, like, you look amazing, but if you want to talk about it, call the office.
Right, exactly. Yeah. Okay. If you
don't want to be the guy, like, let's go in the bathroom and take a look under the hood.
Right.
That's not,
right. Of course not. It might get you more clients, though, not that you need it. But
I don't know.
If you could get your hands on one celebrity to do something to, do you have somebody in mind?
That's a good one. I'd like to get Betty Boop and reverse her BBL.
But she's known for that. People love her for that.
Yeah, but, I could see her, like, walking the runway in a couture, outfit.
Okay. But like somebody that is popular
a real person,
today. Yes,
character.
a real person.
I don't have anyone that I wish I could operate on. And each and every person, celebrity, mom, hedge fund, lawyer, doctor, whoever, each and every patient's just, I'm grateful for each and every person. So I don't have any. I just want to, my dream is to just continue operating on people, that are looking for the same things as me.
Right. To look their best.
Yeah.
With what they have. Is there a certain celebrity that people come in most often as their wish pick that they want to look like?
It's interesting because for now, it's really, because basically everyone is, I guess, is a celebrity on on social media.
Yep.
There's no consistency, because if they're just searching bikini body, it's not like it comes up Cindy Crawford anymore,
Right.
or whoever the hot models were. It's just like literally 100 million girls in bikinis.
Right.
So it's just whoever. It's just everyone. Like
Right.
literally everyone's an inspo.
Interesting.
Yeah.
Okay. Now, talk to me about how you run your office. Sometimes you're working late at night, on weekends. Tell us about, give us some inside scoop about, not the people that come to you, not the celebrities, but how they get treated by you so they're not seen by the public.
Well, the most important thing that in life, if you want to be a surgeon, you need a team. Mm-hmm. And if you want a team, you got to figure out how to be a leader. And if you want to be a leader, you got to learn. So you got to have mentors. You got to read the books. You got to find people that's going to help you. Mm-hmm. And the number one thing is, that I have found is first understand before you seek to be understood. So you have to get to know everyone that's working for you, get to know your teammates, get to know what motivates them, make sure everyone's morals and ethics are aligned. Mm-hmm. That leads to having a code of ethics. We have 4 values that all people who work here, they have to live it like it's their, it is their creed. They have to pursue expertise. So whatever they're doing, nurse, front desk, patient coordinator, anesthesiologist, you have to pursue expertise at all times. Mm-hmm. You have to be a lifelong learner. We have a monthly book club. We are always sending people to conferences all around the world. There's never, it never ends, the search for knowledge. Mm-hmm. Because I always want inertia moving forward. And then we get into the harsher ones. You have to really be good at accepting feedback if you want to work here. Mm. Criticism is the key, okay? Mm-hmm. In a positive way, in the sense that we are always checking each other, balancing each other, hey, when you do this, that doesn't work with patients. We send out a lot of surveys. We're always constantly evaluating. Everyone checks their ego at the door here, and then we generously share our knowledge. So once you have a team of people that are, coordinated in harmony, passionate, it's all about the patient care. And for us, our favorite book in the office, Danny Meyer's Setting the Table, it's hospitality. Mm. We're trying to create a unique experience, a unique surgical experience. As you see, our patients go from surgery in our, fancy wheelchair over to the plaza. Mm-hmm. They have a luxurious stay with a private duty nurse. The doctors, the nurses go visit our patients. We create an environment, an experience that's memorable. We're always trying to catch something about someone, mm-hmm. whether or not they have a wedding coming up or they have a personal accomplishment. We're always trying to connect with them with gifts. Trying to really establish deep, meaningful relationships with our people. The reason for that is simple. We love the people we work with, so why wouldn't we want to have deep, meaningful relationships? And second of all, then they, in a quadratic way, grow our business. Mm. We're 100% word of mouth.
Right. That's interesting, yeah. And
social media is different in what people think. People hear my name, Dr. Anna's name, Dr. Chris's name, and then they follow on social media. Mm-hmm. And then, that's they're dating you one way. They're going to get to know your personality. What do you do every day? A lot of patients find a lot of comfort knowing, I'm a nerd. I go to bed super early. I get up, at 4:15 every day. I'm reading. I'm in the gym. Discipline is everything. To me, good work in the operating room is everything what you're doing outside of the operating room. Mm-hmm. People know, I'm basically working out or with my family. Yeah. And, a lot of people like that in their surgeon. I would.
Yeah, I would too. Having great values and not being a party boy would be my 2 things that I would be looking for.
It doesn't work.
Yeah. I would not like to see you out late at night at
surgery,
a bottle service club.
We talk about it in the office, it's like being a professional athlete. When you're in the operating room, it's physical and mental. And you need to be prepared physically and mentally. That means nutrition, rest, your reading, your exercise, you're good to go.
But it's so interesting that you're bringing that up because I feel like on social media a lot, you see a lot of these very well-known plastic surgeons showing their life in a very flashy way.
Yeah, I don't know. That's not me.
Yeah. But don't you, maybe it makes them more popular and famous. They get more likes, they get more views, and maybe they get a lot of requests for patients. I don't know if it actually translates into a real patient, but I think that some people think it's good to be seen in a flashy way. Right?
Yeah, I don't know.
But you know what I mean? Like, have you seen those Instagram feeds?
Yeah, I think there's always people who want to portray a certain type of lifestyle,
Mm-hmm.
and who knows what really the reason is.
Right.
I don't know if it's, and by the way, if that's them authentically, then that's probably what they should show, because people should know that, this is that kind of person.
Right.
And like, maybe you're that kind of person, that'll work out great. But if you're family oriented and you're not party oriented, then like, you're my kind of person.
Right, right. So you're going back to the
But that doesn't mean like, me and my wife and my kids travel to nice places, but a lot of times we're going to the same places our patients go.
Yeah.
But there's a difference between sharing your life and portraying a certain, level of whatever you want to call it
Yeah.
in terms of flashiness.
Flashiness, yeah. And it goes back to what you were saying about the chemistry you have with the patient is very important. Are there any procedures that you would talk people out of, not necessarily in your office, but for our listeners? Like, are there procedures that you think are not good for somebody to fall into, like the Brazilian butt lift or whatever that's too big?
I think the Brazilian butt lift is a good operation when the aesthetic goals of the patient and the doctors are in line.
Mm-hmm.
Buttock implants is something that very few surgeons on the planet can do consistently and safely.
Mm-hmm.
Because of the nature of where they live, they're close to stuff that's not always so clean. So I think that's a high risk procedure.
What do you think?
There are surgeons who can do it, but like, you can count them on one hand.
What do you think of the people that travel to Mexico or Russia or wherever they're going to get these surgeries
Well, I'd be
done?
impressed if they got into Russia these days.
Right.
But
They did in the past.
I got it.
Yeah.
I think it's funny, I get this question a lot. There's excellent surgeons in every country in the world.
Mm-hmm.
You can name a country and I'll tell you someone who's amazing there.
Mm-hmm.
And there are shady people in every place. As you go into other countries like Mexico or other South America, there's a little less regulation. So there's more chance of having some places that are not going to be up to the same standards as us. But I can assure you, there are moral, ethical, fantastic surgeons in each and every country in the world.
But do you believe that people get what they pay for? I mean, something might be valued at $20,000 here, and if they go to Mexico, they're only spending $4,000.
Well, what's interesting is the surgeons I would refer them to, the price is the same.
Right. But what do you think about people traveling just to get a better price? Do you believe they get what they pay for?
Obviously, in a paternalistic way, I'd say you should save up till you can do it safely.
Mm-hmm.
But that's not my life, and I can't tell people what to do. And I understand they're like, I need this, or they think they need it,
Right.
and they have a budget and they seek out. But yeah, caveat emptor.
Right.
Buyer beware.
Right. Right. I've seen recently on your Instagram you did it look like a complete skin lift that looked unbelievable. Talk about that procedure.
We love doing every operation's great, but you see a lot of these patients that have lost a lot of weight. I think we did it yesterday. She went from 350 pounds to 140 pounds. I mean, that is
wow.
She lost like a few people.
Yeah.
And when you have those people are so dedicated, so committed. They're fantastic to work with. And we went 360 around the world, took all the skin off her torso.
Oh my gosh.
So we're trying to help align her mentally with what she sees, because she feels like a thin, active woman, but she doesn't recognize who she sees in the mirror.
Yeah.
So I saw her this morning, and I think she's starting to recognize herself again.
Wow, that's amazing.
Yeah.
And what's the recovery time on something like that?
Oh, that's a big one. That's a good 2 weeks off work, and it's going to take 6 to 8 weeks to feel like a human again.
Yeah.
Or a normal.
And is she in so much pain?
No. It's not so much pain, but we pushed her front, back, left, and right. So
yeah. And
everything's tight.
What are the scars like?
They fade. I mean, our techniques in the scar cream. I mean, the scars fade. We put them in hidden areas.
Right.
They're covered in most underwear and bikinis.
Amazing.
They fade.
And talk about the boob jobs these days in terms of the scars, because I know in my day when you go from a bigger size to a smaller size and you're getting a boob lift, you have to get a bunch of scars sometimes. What are the new methods?
Nothing's really changed in terms of the lifting. No one's created a way to lift breast without scars. Just like no one's made a tummy tuck that doesn't involve a scar.
Got it.
One thing I can tell you is when people get the shape they want, whether it's the tummy or the breast, nobody cares about scars ever.
Right.
But everyone cares about the shape when they don't get it.
Right.
Every single patient complains, it doesn't look good.
Mm-hmm.
But you don't have a scar. Yeah, but it doesn't look good. Nobody says, this looks so good, I wish I didn't. and they wish they could go back and get rid of the scar. Nobody cares.
Yeah.
You got to get the results, and you take care of the scars. Nobody cares.
Are you getting men as clients?
Yeah, we have a good number of men. Dr. Funderburg, who works for me, kind of specializes in men.
Okay. And what kind of treatments are they coming in for?
They like lipo of their neck, number 1, man boobs, number 2, abdomen, waist, that tire that men get, that lower abdomen, that flank area, number 3. And most of the time they're doing 1, 2, and 3 in one shot.
Interesting.
And again, these are the same type, these are very successful A-type go-getters who just know the limits of their body.
Mm-hmm. So, all right, for the people that are listening, if they are thinking to themselves, okay, I want all this stuff done from the neck down, what is probably the one thing you would suggest that would help them feel and look younger? Is it the boobs? Is it the liposuction?
Well, I think, someone has to say, like, I'm the kind of person who wants the best out of life. Mm-hmm. I'm the kind of person who wants to maximize potential. I'm also the kind of person who's willing to invest in myself. Mm-hmm. And then you got to look at your life. What's the biggest frustration point? A lot of people tell me, in the summer, they can't wear sleeveless dresses. It's their arms. Mm. They don't like, every time they go out for dinner, I hear this all the time, they have to hold in their tummy after babies because the muscles have separated and the skin's hanging out, and they have to wear all these contraptions. These things actually impact every moment of their life. They're like, I literally hold my breath all day because I hate my stomach. Okay, let's fix that.
Interesting. And
know thyself.
Yes, that's right.
And everyone's different.
Okay, and then would you have one piece of advice for people that want a quick fix, maybe not getting plastic surgery? Is it a laser? Is it just drinking water? Like, what can help people look a little bit younger today?
Honestly, the number one thing that I've found in my life is sleep. Mm-hmm. If you can get a good night's sleep, everything is a lot better.
Okay.
Yeah, and that's something that's tangible that everyone can work on.
Right.
When you go home, don't watch, 2 hours of Netflix mindlessly. Turn the TV off, go to bed.
Right. Because you will just feel refreshed and look refreshed.
Yeah, the mindlessness. I mean, everyone watches TV, but, watch a little less. Sleep a little more. Rest, let the brain recharge.
Okay, I like that advice. All right, where do you see plastic surgery going in the future?
I think it's going more and more mainstream. Offices like mine, bigger infrastructure, more services, more layers, just an overall elevated experience. Mm-hmm. I think plastic surgery is not going to be the mom and pop pizza shop, that it used to be, where every doctor had their own little office. Mm-hmm. Patients want the bells and whistles. You see my operating rooms. You see our facilities. Why would you not want, the newest, most innovative, everything, is designed for their experience. Also, we're constantly evolving. Mm-hmm. Those offices, that still have the furniture from the 80s and the Time magazine for Man of the Year with Richard Nixon on it, it's not, people move quickly.
Right.
They want innovation, comfort, and everything up to date. So you're going to see bigger practices, more doctors under the same roof.
What I think is amazing about your office, and for people that, are just listening as opposed to watching, you operate in your same office. You don't have to go to a hospital. It's really convenient. People walk in. It's beautiful here. You get treated really well at the front. You get walked right in, and you go right into the operating room. I mean,
usually we have a consult first, but
yes. But I think for people that have not had plastic surgery before, or hesitant to go visit a doctor because they're nervous, it's like a one-stop shop. You don't have to.
You have more control if you care about your safety in your own house. Mm-hmm. Okay, meaning we design this place with engineers. We design this place with consultants. What's the safest, best way I can build an operating room? Let's do that. Mm-hmm. And then we built 2. I always have 2 anesthesiologists. It's like having a plane. I like 2 pilots around. I have a dedicated team every day in both operating rooms. I've handpicked from the hospitals. They're the best of the best, working together with a common goal of not just getting, the best possible surgical outcomes, but the safest. We have someone who's full-time on infection control. We have someone who's full-time dedicated to cleaning instruments. We have someone who's full-time dedicated to cleaning the operating room day and then someone at night. Wow. I mean, it's 24/7. But that's, do everything the way we would want it. Mm-hmm. The hospitals are great. They're important. But, you don't want to have your tummy tuck in a room where they just did, a hemorrhoid or a brain operation. Right. And, the team doesn't really know. Right. Everyone knows here what everything is. And they have the same goal.
Right. How hard is it to get an appointment with you right now?
We're booking consults into September, but which is a few months away.
Mm-hmm.
But my associates, you can see sooner, who are amazing, and we always find a way.
Right. Tell people where they can find you, where they can reach out to you, how to look at your
We
work.
are located in the greatest city in the world at 4 West 58th on top of Bergdorf on the 12th floor. It's where the dreams are made, overlooking Central Park. You can find us online at NeinsteinPlasticSurgery.com. You can follow me at Dr. Neinstein or give us a call, 212-249-0949.
Okay, they're right across the street from the plaza. You guys can come, do a little shopping, do a little eating, and have a really nice consult. And
We help people. We have a personal shopper at Bergdorf for our patients.
Oh.
And we also help with dinner reservations. We have someone who can help
amazing.
with
So you have a concierge business
Exactly.
as well. Oh, talk to me about some of the procedures that I'm going to get right now. I think I'm going to do a little filler, Botox, maybe a
Oh,
laser.
you're getting the Uptown tune-up right now.
Yes,
This
I can't
is the
wait.
Uptown-
So I'm going to go from 48 to what, like 35 years old or
Yeah,
something?
somewhere about that. No,
Okay.
we're just going to make you the best version of you, the Uptown tune-up. Just a little bit of, a spritz of everything.
Okay.
And, it's a little glow-up because
Thanks.
everyone deserves one.
Of course, to give somebody a little
Zhuzh,
confidence.
as they say.
To get me on Bumble, maybe. Yeah, so I'm going to take some new photos of myself after, and
Exactly.
it'll be great. Okay, well, thank you so much
You're
for your
very
time.
welcome.
I appreciate it.
You got it.
Surgery.
So he does all this surgery here. He doesn't even go to
Yeah.
Okay.
We have 2 surgical centers. So this is like where we get the laser, injectables.
Okay.
Yep, this is our staff lounge. Tara. More consult rooms here.
And do you help with the surgery?
I'm not medical. I'm like anything non-surgical.
Got it. Okay.
So this is our surgical coordinator, so she'll give you the quote. You come in her office,
Cute office.
another room, all the way
Love that.
And then the 2 associate surgeons are here.
Okay.
And then Dr. Neinstein's office is here in the surgical wing.
Okay. And that's where people are
These
getting
the 2
surgery?
operate, yeah.
So I'm close to 50 and I want to do whatever I can to get immediate results to look a little bit younger. So what are the procedures that some people should do, or me in particular?
Alright, sounds good. So I think we should definitely start with your skin, do a little bit of Lutronic Ultra, kind of clean up those sunspots that we've had from over the years, helps with pore sizing, and just gonna give an overall brightness and glow to your skin. So that would be your base. You can always do a little refresh with some Botox, just keep everything nice and high and lifted. Go in with maybe some jaw filler and kind of give you a little pull back, a little lift from where your face was maybe like 5 years ago, and just give you a little extra oomph.
Perfect. I'm so excited. Let's do it.
Perfect.
So where do people start to age first? Is it the sagging in their jowls? Is it around the eye sockets?
So it's usually like the mid-face, like around the cheeks, the eye sockets. You start to lose volume starting at the age of 14. You also lose bone volume. So it's really like what I said, like it's kind of like your favorite photo from 5 years ago. You want to kind of just reverse time and kind of just enhance that area. We don't want to change your face. We just want to kind of give you back that little oomph that you had.
What are your thoughts on when people come in with like shots of themselves in those filters? You know how it has like the snatch jaw and the really pointy chin. Does that make people look younger?
It does make people look younger. I usually like to just ask them to bring up a photo of themselves from 5 years ago. We kind of talk about the differences. I do side by sides, and I bring the filter and then I bring that photo, and I kind of have them become a little bit more realistic goals
Got it.
based off their anatomy.
So you don't necessarily want to change the shape of their face. You want to make it what it was.
What it was, but like if they are looking for more of a snatch drawing, that's obviously something that a filter I'm looking at. But if they're saying, I want to puff my cheeks, I have to see like what their body's actually capable of. So that's something I'm looking at.
And what are the signs of somebody that has too much filler?
Usually their face is actually falling naturally, their face is too heavy. Filler's supposed to lift and contour, so if they're not getting that nice chiseled look and that nice lift, usually it means it's either put in the wrong place or just too much. Filler really shouldn't migrate in the sense of if it's placed within a good amount of time, it should stay where it's placed. So if you're kind of getting lumpy in between, it's usually because there's just too much in there.
Right.
So we're going to go ahead and start with the laser.
Oh, it doesn't matter. Okay.
This is warm, it'll be a little bit red. Lasts about 90 minutes to warmth feeling, and then within the first 90 minutes to like 4 hours, somewhere in there, the red pink will go away. You will feel worse than you look. You kind of look like you just spent an extra 2 hours at the beach. And nothing too terrible. You'll wake up tomorrow, you'll be a little bit dry. Avoid retin-A, avoid toners, anything that's your dry smell more. And then 7 to 10 days for your best glow. Lots of moisturizer, lots of SPF. You can be in the sun as soon as 48 hours.
And does this help so that I don't have to wear makeup as much?
Exactly. So less makeup, going to try and create the most even skin texture possible. Reversing that sun damage, get rid of some wrinkles and freckles because it's stimulating collagen as well.
What is this called?
The Lutronic Ultra.
And what's the difference between like this and a blood facial?
So this is using thulium gas to create little microchannels in the skin. The PRP Vampire Facial isn't just microneedling and then your own blood, so just different mechanisms. This is naturally so a little bit more powerful, getting deeper down into your skin cells.
Do you guys do the PRP?
No.
Because you don't like it as much?
Because we find that this works better and people have better results.
Amazing.
It's actually less downtime too. Sorry.
That's okay. It's just on the temples of it.
It's the worst. I feel like during the summer people want to wear like during the day to run errands, run tennis, whatever. Like they don't have a full face of makeup. This is like perfect to even out your skin tone. And then you're just wearing like, tinted moisturizer and you're ready to go.
Great. Can't wait for that. Oh, you can't tell that much, right?
It looks like you just got back from Miami.
Right. Oh, great. Okay.
This is just to cool you down.
Okay.
We'll go ahead and go do the Botox next if that's okay.
Yep.
Cool you down again, just a little antimicrobial. So we're gonna work on just kind of keeping your forehead and keeping your eyes nice and smooth and around your eyes.
Okay. So like when I'm in the sun, I notice like I squint a lot and see all the wrinkles in here.
Yep. So
Little
those are gonna be
Botox
softened and then also give you a little eyebrow lift.
Okay, cool.
And Botox works in the muscle, so it takes about 10 to 14 days to fully see results.
Oh, yeah, I'm starting to feel the heat now.
Definitely gets a little spicy.
Okay.
Go ahead and make that mean face for me. Couple quick pinches, a little pressure. And raise up when you're ready. Raise up again. Is it getting really tight?
No, this doesn't hurt.
I was hoping once you do the laser first, I don't like just let it.
Yeah.
So use some numbing on your lips.
Okay.
Some lotion. You want to do upper and a little bit in the lower chin?
Yeah.
Just give you like a nice little juicy palette. No facials for 7 days, no like massaging on your face for 7 days.
Okay.
Just so everything can set in. So do a little bit in your jaw just to pull you back. Is that
Okay.
And all the way back for me, I'm sorry. And then
That's okay.
Tilt. Back here. Sorry.
Now, why do some injectors use cannulas as opposed to just using a needle?
Just based off the technique and the needs of the patient. I feel like you already have a great jawline, so you don't really have to structure and create the jawline. If you were someone who needed a little bit more, like arch, she says, I would say, and didn't have that jaw structure, I would probably use a cannula.
Got it.
I'm gonna twist her a little bit. It's just like part of my lower facelift, surgical, just to kind of fill in those little gaps. It's fun to be.
I love filler.
It's magic, and it's just a little magic pen essentially.
Yeah.
So really, we're able to put it back a little bit, give you a little more structure,
Mm-hmm.
and then just soften this. It's kind of like an infinity pool. We're gonna start but no stop, and nice and streamlined.
Right. Okay.
All right. So we're gonna go ahead and do a little bit in your lips.
Okay.
When was the last time you got any injectables or did anything?
Probably not. I mean, I had maybe Botox maybe 6 months ago. Injectables.
Okay.
I dissolved a lot of stuff. And I was telling her I probably haven't gotten my lips done in like a year.
How often should you get injectables, Tara? Like it depends on each person's different, or what do you do?
I would say that for Botox for maintenance, it's definitely important to stay on like a routine every like 3 to 4 months. It depends on kind of what you are looking to do. If you're looking to build up something, obviously it's gonna be a little bit more often. And it also depends on how much you metabolize it. Some of my patients who do get filler and they work out all the time, they're coming 2-3 times a year. It's also like a personal preference thing too.
I was going to ask that too, because sometimes I'll go to people and they'll use different things in me, and I must metabolize it faster.
Certain products, yeah.
Yeah.
I also feel like anytime you're trying to create something, like again, if you didn't have a jaw structure, I don't want to just flood your face with fillers. So I'd probably say maybe start with 2 or 3 syringes, then come back in like 4 weeks or reassess, always add. I like to build rather than just putting it in your face.
Yeah.
Right. Keep chin up to the sky for me, and then keep your mouth open. Really good shape, so I'm kind of just going into fill where till the quality wants.
That numbing cream is amazing. I don't even feel it.
It is like a game changer.
Normally, people don't get that right.
Really special pharmacy. It's crazy, strong. Take a peek. I'm going to work, just grab a little bit more for the bottom.
So Adam, normally I would say, let's go get a drink, but I can't be seen like that.
I get it. I get it.
But we'll go get a drink when I have my finished face.
Listen,
Okay, so I just finished my procedures with Nurse Tara. I look a little bit like a monster right now, but the finished product we're gonna see later. Thank you so much, Tara, and thank you so much, Dr. Ryan Neinstein, for having me. I enjoyed being here, and everyone should check them out on Instagram.